So for Ontario, I'd say we're just starting to see a little bit more flu activity. We are starting to have a little bit increase in our number of cases that we're seeing reported to us from laboratory findings of influenza, as well as starting to hearing about some of our first outbreaks of influenza in places like long-term care facilities. So we're a little bit later compared to some other parts of Canada, particularly in the prairies, where they've been starting to see much more influenza activity compared to the rest of the country. So Alberta particularly has had quite a few influenza detections already, but we do, it's not unusual that one part of the country will start a little bit ahead of the other. So we know that that's sort of a signal for us that probably soon in the next few weeks we'll be having a little bit more activity as well. In Ontario, as I said, we've been pretty early, so we only have kind of still relatively few number of influenza cases. We've had a little bit of a mix of both H1N1 and H3N2, but I would say the signs and more recent detections we're having have been a little bit more towards the H1N1 component of the influenza A virus. And that's certainly similar to what we're seeing in other parts of the country, such as Alberta, that's having a little bit more activity, as well as in the States as well, that so far, while we're still quite early in the season, it's looking like the main type of influenza A we'll see this year is probably more likely to be an H1N1. Yeah. H1N1 can affect all ages, certainly, but we know that seniors and older individuals have a little bit better immunity against H1N1 because it was something they were exposed to when they were younger. So typically the groups that can be a little bit more affected when we have H1N1 dominant seasons are children, younger adults, and younger adults. So certainly we are seeing from the prairies as well, there has been a little bit of an increase in the numbers of pediatric hospitalizations that are occurring. And I think that that's not unusual to see when we have an H1N1 dominant year. Yeah, I think most people's experience of flu is that fever, cough, muscle aches, extreme fatigue, but certainly for people who experience more significant complications that can go on to have a pneumonia, end up in hospital, may have a secondary bacterial infection that also compromises their pneumonia and makes it difficult to breathe. And I think people with underlying conditions can also manifest in other ways. So people with underlying heart disease may experience worsening of their heart conditions. And we also have some recent evidence to say that people are actually at an increased risk of heart attack in the first 7 days after having influenza. So I think, the kind of complications that people may not even necessarily think are related to flu are certainly worsened and exacerbated by having influenza. Well, in Ontario, everybody is recommended to get the flu shot. We have a universal program, but certainly the high-risk groups that are people we would want to absolutely make sure are getting the flu shot. So those include seniors over 65, children under the age of 5, people with underlying health conditions like respiratory or heart conditions, pregnant women. These are all groups that are at higher risk of having complications of flu when they do have influenza. So those are all ones we would absolutely recommend to have it. And as well, the people who are around those individuals, to try to protect those individuals even more, we would recommend anybody in a household with somebody who's at high risk, or if you're somebody who's interacting with people at high risk, like a healthcare worker, would also be recommended to get the flu shot. Well, the main active ingredient are the strains of influenza that we're trying to protect against. So all the flu shots, and the main flu shot that we have this year is considered a quadrivalent product because it's covering the 4 types of influenza that we see. So 2 types of influenza A, the H1N1, the H3N2, and the 2 types of influenza B that we see circulating, a Yamagata and a Victoria strain. So that really is the main ingredient that we have in the flu shot that helps your body be familiar with those types of influenza, and then you can mount a better immune response when you encounter that influenza later in the season. The other ingredients within the flu shot, like any other medication, are there to help both stabilize the product to make it safe within that component, as well as to also make it not contaminated. So we have things like antibacterial agents to make sure it doesn't get contaminated. We also have stabilizing agents to make sure that it's product stable. It can be on the shelf for several weeks or months through the flu season before it's being used. The final ingredients are also considered adjuvants, so things that help your body recognize, oh, there's something there that I need to respond to, and help build that immune response so that when your body can actually recognize those vaccine strains that you're being exposed to and build that immune response that you need. Sure, that reaction, that pain, redness, swelling in the arm is the most typical reaction that we see from the flu shot, and is something people should be aware of when they're getting it, is that you will have a little swelling, a little bit of soreness in that arm. It usually lasts for 1 to 2 days and then goes away. So that is the most common reaction we would see, and people, not to be unexpected that might happen. Some people have a little bit more overall reaction, so like maybe have a slight mild fever for the first day, a feeling a little bit of unwell. But again, those are all generally very mild and very short-lived. People usually kind of only have it for the first day or two. Some vaccines have a little bit more reaction than others. So we know this year for seniors 65 and older, we do have a product called the high dose vaccine product for seniors that has 4 times the amount of the vaccine strain for the 3 types of vaccine that it covers against compared to the other product. And because it has that more, we're trying to build a really good immune response in seniors, because we know generally they don't build that same immune response. But because that vaccine has a little bit more in it, then people can expect to have a little bit stronger local reaction when they get that vaccine compared to the usual vaccine they might have gotten previously. Yeah, I mean, again, like those sort of milder, a little bit of redness and swelling are not to be concerned about. I mean, you can apply some local ice to bring it down. If people do have a mild fever, you can use things like Tylenol, acetaminophen to help treat that fever or to help treat the local pain and redness. But those are typically very mild reaction. Obviously, if they're having a more serious reaction, if there's anything that's concerning right away after that vaccine, obviously to seek medical attention right away. And all immunizers who provide vaccines are trained to look for any immediate responses that might be more serious reactions. But those are all incredibly rare, less than 1 in a million kind of reactions. Sure, yeah. So we typically say on average it's about 2 weeks from when you get the flu shot to when that flu shot is really working in your body. Because your body needs time to recognize that virus, to build the immune response to it, so that after about 2 weeks you now have that immune protection against it. So if you got sick right away, I mean, what we call any virus has what we call an incubation period. So that time between when you're exposed to it to when you get sick from it. And for flu, that's typically in the range of about 1 to 3 days. So if you got sick the next day, you probably got exposed to something a couple of days before that's making you sick. And so really has nothing to do with the flu shot. It was just sort of bad timing that you happened to get your flu shot just as you were about to get sick with something else. The other thing to remember is that there's, the flu protects against influenza, but there are many other respiratory viruses out there that can also cause similar symptoms of cold, runny nose, fever symptoms. Particularly, we still have quite a bit of rhinovirus and enterovirus circulating at this time. So, just because you get sick with something that might look and feel like flu, it doesn't necessarily mean it's flu. But until we're kind of really much more into flu season. Yeah, the flu is not a very unpleasant thing to have. You feel tired, you feel worn out, sometimes you feel like you got hit by a truck, all you want to do is lie on the bed. So, I mean, taking care of yourself during that time is really important. I think the first thing to remember is that if you're somebody who may have an underlying condition that puts you at risk of complications, to check in with your healthcare provider to say, I think I'm having the flu, what should I do? If you're really at risk of potential having complications, having that conversation even now with your healthcare provider, because one of the treatments that is available is an antiviral, often called Tamiflu. And for people who are at risk of serious complications, that can be a worthwhile treatment to have, but it needs to be taken as soon as possible as when you get sick. So having that conversation with your healthcare provider now to say, you know what, I'm worried I might get the flu, they can maybe have arranged with you a way that you could start that medication as soon as possible if you're looking like you have symptoms of influenza. But for most people that are not in one of those categories and are at high risk of getting complications, really just taking care of yourself during that time, getting good rest, making sure you're staying away from others, you're not spreading that virus to other people, getting lots of fluids because you're going to be sort of, losing a lot of fluids from being sick, and getting a good rest during that time as well are all helpful things that you can be doing. With any kind of nasal congestion, steam or kind of more humid environments can be helpful to help clear that congestion. Things like neti pots or saltwater rinses for your nasal congestion, that's always helpful. And then kind of soothing warm liquids for any throat irritations. Those are all kind of comfort measures that people can do to feel better. Yeah, I think the other piece would just be that, the flu shot is incredibly important. So if you haven't had it, it's not too late now that they are available through your healthcare provider, health units or local pharmacies. So now's a good time to get it. We are, kind of heading into a holiday season where you might be mixing and mingling with a lot of people. So good to have yourself protected. And the other things you can do to stay healthy through the season is to wash your hands frequently, make sure, if you are sneezing or coughing, that you do it into a sleeve, and that if you are really sick, that you are staying at home and not passing that on to others.